When Tim and Najet first asked me to speak today, I didn't really have any idea what I was going to talk about for the next few minutes. At first I thought I could just copy and paste whatever last year's person said, except they didn't really have this section last year. And depending how this goes, they may not have one next year either. I've attempted to write something that could encapsulate our experiences at Imperial over the last 6 years. I thought about likening our year to the cast of Friends, or the cast of Scrubs, or even presenting our year as a disease or a long case. Then I realised I didn't have the humour or the medical knowledge to pull it off. I also realised how difficult it was to describe our year. There was no way to encapsulate the 6 years we have spent together, or the personalities within our year of over 360. Even when we first stepped into the giant glass building that was the Sir Alexander Fleming, everyone knew that we were different. We were the biggest year the medical school had ever seen. They even had to build us an annex, as not everyone could fit into the lecture theatre. We were also one of the brightest years, and the more polite years, if the views of some of the faculty were to be believed. And, even in the face of a GMC inspection, which meant another person in the room to watch us mumble our way through our exams, we achieved a huge final success rate. And I truly believe that our years at Imperial have been special. Not only because we have found amongst our cohort some of our bestest friends, but also a great platform from which we can launch successful careers. I don't think I could do justice to reminiscing about our years at ICSM. I would undoubtedly miss key events and places if I just listed the Roadshow, RAG, Ponarnars, Havanas, Hombres, Varsity, concerts, plays, and of course the Reynolds. Rather than attempting to describe my colleagues or trying to paint a picture of the last 6 years, I thought I'd tell you an incident from my last week of shadowing an induction at my new hospital, which will highlight one of the many moments when I realised I was no longer on Imperial's training grounds. Our induction session was on infection control, right before I had to be assessed on taking blood, on a plastic arm of course, and writing up fluids. And the lecturer was asking us how we'd manage different infection control situations. My question was how I'd manage a suspected case of tuberculosis. As well as breaking out in a small sweat from flashbacks from finals, I suggested that you might want to move the patient to a negative pressure ventilation room. We don't have that here. Okay, well, I'd also like to notify the consultant in communicable disease control. We don't have that here either. Okay. I was told the answer was, wear a mask whenever you're near the patient. I think this highlights that we experience very different diseases and different training here at ICSM, and whilst we may not encounter the same things at other hospitals, we will be able to adapt and do our best. I'm not saying Imperial's training is better than the other places, but I'd like to think it is. Sadly, circumstances have meant that our year will be dispersed across the whole of the UK, from Cornwall and Devon to Bolton and Manchester, from Northern Ireland and Norfolk to the ghettos of Milton Keynes. We will be a very scattered cohort, which is an even greater reason for us to keep in touch. The alumni was set up when the Students' Union and the faculty realised that after the days of St Mary's, Charing Cross and Westminster, there needed to be a way for the former students of ICSM to stay in contact with each other and for the spirits of the former medical schools to live on through us. Our alumni association is young, and it needs us to join and become members to secure its future. Some of you may be thinking, why do we even need one? I have the numbers of everyone I want to speak to after today. I don't want to or need to contact anyone else in this hall. But the Alumni Association is more than just a glorified yellow pages. Sure, you'll stay in contact with who you want to in the first few years, but it's when, a few years down the line, greater work constraints and even greater geographical distribution will mean it will be even more difficult to keep in touch. The association is a way to keep us dated on each other's news, so that in 20 years' time, when we find out that Zach Silk is Chief Executive of the NHS, or that Claire Hodgkiss realises her dream of playing the Little Mermaid on the West End stage, you can be reminded of the days when Zach's greatest enterprise was Rendezvous, and when Claire dressed in 80s gear and danced around on the stage at Wilson House. The association will also allow us to celebrate the announcements that you may have, whether it's exam success, promotions, whether it's an engagement, congratulations tomorrow, weddings or births. It will be a good way to keep us informed. And I'm sure there's more to come. Remember in our first year when someone stood up and told us that a third of you will end up together? I'm pretty sure we've not reached the third yet, so maybe today you should look around, get to know the people sitting next to you, speak to someone you've not gotten to know over the last few years. As I said earlier, the Alumni Association is much more than the means of staying in contact. It's a way for you to contribute to the ongoing strength of the medical school. Your subscription will not only fund the Gazette, but it will fund elective awards, musicals, plays, sports tours, and all these things that we took for granted at ICSM. All these events which shaped our lives here. and have undoubtedly played a huge part in bringing us here today, together, as doctors. Now, I'd like to introduce the President of the Alumni Association to convince you even more into joining the alumni. Most of you in this hall will know Dr. Chachter from when he was head of Year 3 and more recently the course lead for our final year clinical pharmacology therapeutics. Without him, we would never know the fourth-line antihypertensive for pregnant epileptics, or what painkillers a consultant pain specialist would prescribe when dealing with a patient allergic to analgesics beginning with vowel. Ladies and gentlemen, Dr. Chachter.